You're a home health agency owner and you're being squeezed from both sides. Your Medicare and Medicaid payments are being cut by 9%, reducing payments by over $1 billion. At the same time, your operational costs are skyrocketing by 15 to 40%. You feel like you're doing everything right, but it's still not enough. Today, I'm giving you the Profitability Blueprint, a battle-tested framework to protect your margins, automate your biggest costs, and thrive even when the system is stacked against you. We're going to transform your agency from a victim of a broken system into a financial fortress. Part 1. The new profitability equation. The old way of running a home health agency is no longer viable. You cannot simply accept declining payments and rising costs. You have to change the math. The old math was simple. Revenue minus cost equals profit. When revenue goes down and the costs go up, your profit disappears. This is why so many agencies feel like they're in a survival mode. The new math is different. It's about a radical overhaul of your cost structure. It's about making your operations so efficient that you can absorb the payment cuts and still grow. It's about using technology to create a new, unassailable margin. I have seen this firsthand with my customers. Like a Tampa-based company, they were a growing agency, but they hit a wall. They discovered that they had lost over $50,000 in a single year just from unbilled claims and missed documentation. This was not a small oversight. It was a symptom of a broken manual process. They were stuck in the old math. They were drowning in paperwork, phone calls, and manual entry, which took an average of 45 minutes per intake. By implementing our AI agents, they were able to reduce that time to just 3 minutes. This is Profitability Blueprint. It's a system for systematically identifying and eliminating waste and cost in your organization. Here are the first 3 steps in your blueprint. Stop doing manual tasks. Every hour your staff spends on paperwork is an hour that they're not spending on patient care or a more valuable task. Identify your biggest time sinks. Is it prior authorizations, scheduling, billing? Find the one that costs you the most and start there. Use technology to create a new margin. Automation isn't just about saving time. It's about building a sustainable profit center in your business. Part 2. The 3 major cost centers. There are 3 major areas where you're losing money and time right now. We're going to show you how to attack them one by one. Cost killer number 1, the billing black box. Your billing process is a black hole for your revenue. Manual claim submissions, slow follow-ups on denials, and inconsistent documentation all cost you time and money. Every time a claim gets denied, you lose a portion of your profit margin. One of my clients, a smaller agency, was losing an estimated $50,000 a year in lost revenue just from a billing company that wasn't following up on denials. They were getting denial spreadsheets, but had no proactive communication. The billing process was a black box. We created an AI billing agent to fix exactly this. This agent predicts denials before they happen, flags inconsistencies in documentation, and ensures claims are submitted with a 95% clean claim rate. For Medicare, straight Medicare patients, we also have third-party billers who are experts in episodic billing. This isn't about replacing your billing staff. It's about giving them a tool that eliminates manual errors and frees up time to focus on more complex denials that need human touch. This is how you go from cash flow problem to a competitive advantage. Here's how you can automate your billing. Audit your denial reasons. Look for patients and understand why your claims are being denied. Is it a missing code, a documentation error? Automate claim submissions. Use a simple bot to submit claims and automatically track their status. Implement pre-submission QA. This is crucial. Our compliance agent can review documentation before billing to ensure it meets medical necessity requirements. Cost killer number 2, the intake time sink. The intake process is one of the biggest time sinks in your agency. From the moment a referral fax arrives until the patient is in your system, it's a series of manual time-consuming steps. I've spoken with agencies that receive up to 30 referrals a day, but are only able to process 3 to 5 of them. This is not because they aren't working hard. It's because of the process. It is too slow and manual. Every minute a referral sits unprocessed, you run the risk that patients going to a competitor. We've created an AI intake agent that completely automates this process. When a fax comes in through your Ring Central, it is automatically scanned and information is extracted. The agent checks insurance eligibility and homebound status within seconds, not hours. Then it can send a confirmation text message or make a phone call to the referral source, confirming receipt of that referral. Now, here's how you can automate your intake yourself as well. Consolidate all of your referral sources, whether they're coming from WellSky, CarePort, Fax, or maybe a single platform that can manage it all. And then you must automate data entry. Use an AI agent to automatically extract information from referral forms and enter into your EMR, whether it's Allura Plus, CanTime, Kinser, whichever one you're using. Now, next step is speeding up the confirmation. The agent can confirm with referral sources and nurses, dramatically reducing the time it takes to accept a new patient. Here's the cost killer number 3, the communication chaos. Now, your agency's communication is likely a chaotic mess of phone calls, voicemails, and internal messages, apps like Tiger Connect, Health Notify. This chaos leads to missed calls from potential patients, wasted time for nurses, and administrative errors. I've heard countless stories from agency owners who are still using paper lists and manual processes to manage their staff. One of the most frustrating things is when a nurse shows up to a patient's home only to find out that the patient is still in the hospital or they're not ready for care. This is not frustrating. It's a waste of clinicians' valuable time. My team has developed the AI voice agent, which can handle this chaos with ease. This agent can act as an after-hours receptionist, answering every call, triaging it, and ensuring no referral is ever missed. It can also call patients to confirm appointments, dramatically reducing no-shows and wasted time. And as far as your nurses, it can even call the patients to do post-visit QA questions and collect notes, which are then automatically transcribed and entered into your EMR. So here's how you can automate your communication. Implement an after-hours receptionist. A voice agent can ensure every call is answered, triaged, and logged. Automate patient and nurse confirmations. Use a voice agent to confirm all visits, saving your clinicians from wasted trips. Streamline visit notes. An AI voice agent can call your staff to collect visit notes, which are automatically entered into the EMR, ensuring compliance and reducing administrative burden. Part 3, the path forward. This isn't about throwing out everything you've built. It's about augmenting your team with AI so they can focus on what they do best, patient care. I know it sounds like a lot, but we don't have to do it all at once. My approach is to crawl, walk, run. We start with a pilot program focusing on 1 or 2 of your biggest problems, and we prove the value. We'll start with a pilot. During this time, our only goal is to show you results and ensure this system is perfect fit for your agency. Once you see the savings, we can talk about scaling. My team and I are here to help you get started. We would love to do a deep dive discovery meeting to understand your current process. We'll map out your current workflow, identify your bottlenecks, and design a custom AI-powered solution for you. This is not a sales pitch. It's a collaborative effort to build a system that works for you. We want to make sure that you win because your success is our key performance indicator. So, your EMR integration journey and your profitability journey starts now. This is just the beginning. In our next video, I'm going to show you how to solve the nursing shortage crisis. We're going to reveal a system for automatically recruiting nurses, screening them, and keeping them engaged. So you never have to lose a referral again because you don't have enough staff. Click here to learn how to solve your staffing problems forever. And for now, get the profitability blueprint from the link in the description to start your automation journey today. Your nurses will thank you. and your bottom line will too.